with the cycling protocol, there are like 4 phases. There's the assessment phase, and then you have 3 intervals and a cool down interval, which is like 5 minutes. But all the other intervals are 10 minutes total. The way in which the protocol works is with the assessment phase, you're going to be assessing whether the patient does any active cycling. If they start doing active cycling and during that 10 minutes, if it's greater than 5 minutes of active cycling, then you're gonna progress to an active cycling interval where you increase the resistance to gear 1. However, if they're not actively cycling or they don't hit that 5-minute threshold, then you're gonna increase the RPMs, the speed. So with the assessment phase, it starts at 10 RPMs. You're gonna increase that to 25 RPMs during the interval 1, and then as you proceed to interval 2, you'll bring it back down to 10 RPMs. The goal, again, is to try to get your patients to actively cycle, so we hope with decreasing the speed, they'll try to maintain that speed and start actively cycling during that second assisted interval. So we'll go ahead and get started with the bike setup. So on page 29, you'll have where it says setup and takedown. The biggest thing that you want to make sure that you do is plug in the bike before you start setting it up. It goes through like an initiation process where you want to have it on before you put the legs in so that it can calibrate. And then I'm gonna turn this so that you guys can actually see the screen. I don't have, do you guys have a bike that turns like this?
No.
Okay. So with the bikes like this, you pull this little peg here and you can turn it. I know some of the bikes, we have a bike where it doesn't have that ability, and so you would have to come in from the footboard and then make sure it locks, because sometimes these don't lock all the way. And then with most ICU beds, you have to end up taking the footboard off. This one's super short, but most of the time you have to just take it off because it's so high, you can't get the bike in the proper position. And so one of the other things with setting up the bike is a lot of the beds are different, and so there might be things underneath the bed. You have this spreader bar here that you can pull out and kind of readjust if you need to. And then the other thing is a lot of times this is set normally like that, and so in order to move the bike up and down, you have to actually pull this out, and so you can get to this little pedal here. And you want to make sure this is unscrewed so that you can pump it up. And then to get it to come down, so a lot of times that ends up getting broke on a lot of bikes because people forget to unscrew this part and they're trying to pump it up and down and it breaks. And the other thing for bike setup is if you have a patient that's a little bit shorter and is higher up in the bed and you need to extend this once you get it positioned, it has a crank where you can extend it out or bring it in. And you just need to make sure that these little things are unscrewed so that it is able to go out and in. And then once you get it in a good position, you can screw it back because sometimes it will wiggle when they're trying to cycle, and you want to minimize that motion as well. Right. And everyone can kind of see the screen. So the other thing you want to make sure you do is drape the patient, since they're going to be kind of exposed with their legs spread open there. So I usually bring an extra sheet in. And then I bring some towels to pad the calf plate, and then I also put a towel on top of their leg, just so the straps aren't rubbing against their legs and leaving marks. I know some of the bikes have like more of the like rubber straps and not the cloth ones, so that can be a little irritating for the patient. Any questions so far? So to adjust the calf plate while you're trying to get their legs into the bike, you pull this little peg here and you can lower it. And then once you get their leg in, you can crank it back up. You want to make sure sometimes the little rubber piece gets wrapped around this part of the metal, this part here, and then it doesn't operate correctly. So you want to make sure that the tubing is like on the inside part of the metal. And then you want to make sure that the calf plate is about 2 inches from the crease of their knee. It should say that in the book as well. And like I said, I like to do 2 towels, one on the bottom, one on the top. Many of our patients are pretty edematous too, so it just helps protect the integrity of their skin. And then this little, and I'll come around to the other side in just a second. But this little piece here is kind of challenging sometimes to get into place. And you have to kind of finagle with it a little bit. Stand in front of you, please.
So that bottom towel spans the calf plate?
Yeah, I tend to
up
put
the
it in
plate.
between just to have a little bit more protection for the patient's skin, if that makes sense.
Yep.
Alright, bring your foot down. So he's a very cooperative patient. Sometimes I feel like I'm fighting with the patients if they're agitated. It's always fun when you start the cycling protocol and the patient's nice and sedated, and then the team wants to start decreasing the sedation and wake them up, and then you're like fighting with the patient the entire time. Well, if that's gonna happen to you.
Can I ask you just a question?
Yeah.
Sorry to interrupt.
Yeah, no,
but,
it's fine.
When we have patients who are heavily sedated, and especially if they're larger, they tend to, like, their legs sort of tend to splay
Outwards.
Outward.
Externally
and
rotated, yeah.
and they don't look uncomfortable to my eye, but the nurses sort of get a little bit worried. I've been told that by a physical therapist here last year that I think it was Amy, it's okay.
Yeah, it's okay. Some of the ways we try to fix that is just by putting like a pillowcase or like another towel like on this part of the calf plate, just to kind of push them into that internal rotation, if that makes sense. Okay, and that can kind of help with a better alignment. As long as there's like no other like edema that's really preventing them from getting into that position. Because I've had issues with just edema being the reason why they're so externally rotated. And at that point, you just kind of have to leave them in that position because it's probably more uncomfortable to keep them internally rotated.
So to be clear, if we can't get them into normal position, we do cycle them with external rotation.
Okay, I just wanted to confirm that.
Yeah, I've actually had a patient before with like a lot of scrotal edema, and I knew that if I were to bring his legs into that more neutral position, he was not gonna like that. So I like just kept him in that externally rotated position, just so for his comfort. And so this is a piece that sometimes you have to like fight with. But usually if you bring it kind of up as you turn it in and then bring it down. A lot of people will leave it like out to the side. You don't really want to do that because if the patient does start to like kind of fidget a little bit, you run the risk of their foot kind of coming out because the straps aren't that secured. Alright. And so that's pretty much it for like setup. Now we're gonna go over like the screen and stuff. Any questions so far about setup?
Is this kind of your standard position with regard to hip flexion?
Yeah.
When we have set the bike up, we actually lower the entire bike so that they're not quite in as much hip flexion, so their legs are a little closer to the bed. I was just curious if that's kind of your standard approach.
So it's also going to depend on like what type of lines they have. If they have like a femoral A line, then I won't have them in as much hip flexion. But having this much hip flexion is perfectly fine. And then I usually take them through like a cycle just to see what their knees look like as they're circling around, because you don't want a lot of hyperextension either. You want to be nice to their knees. So, and I think it even says to rotate them through a cycle, and you want to see about 10 to 20 degrees of knee flexion as they maximally push out. Pretty sure it says that somewhere. Alright, so now we're going to go over the screen, and that's going to be a little challenging to see, so if anybody has any major questions or needs to come up and look at it closer, you can, and we can go over it more during the cycling QA. So with starting the bike, since we plugged it in, it already shows the screen, so you don't have to push anything with the red button. You're actually going to hit leg trainer. And so, in order to know whether or not the patient's actively cycling, you have two ways of knowing. Right now, there's this tortoise and this hare, and that allows you to increase the RPMs, the speed. So if you see those two items, then you know that he's passively cycling, because it's giving you the ability to adjust the speed. If you were actively cycling, you would not have that ability. You would not be able to change the speed, because it's based on his active ability to adjust the speed himself. So then if you were to actively start cycling, go ahead and start actively cycling for him. There you go. So once he starts actively cycling, this bike comes up on the screen. And then you also have the ability to adjust the gears. And so like one of the buttons says light, the other one says heavy, and then you can increase the gear just by hitting this button here. Okay. So some of the nuances, and I know it gets a little tricky with the protocol. So say for instance, during the assessment phase, the patient was able to actively cycle for that greater than 5 minutes, but then by the end of the interval, he's passively cycling again. You would not be able to increase the gear, the resistance. So you would have to wait for him to start actively cycling again before you could actually increase that resistance. So that's kind of one of the annoying aspects of the bike, is you don't have a lot of ability to adjust those things when they're not either actively cycling or passively cycling if you're trying to increase the gears, okay? Have you noticed that too? Yeah. So that's kind of it with the screen. At the top of the screen, it's going to tell you like the total time. And in order to, so say you're within an interval and you're trying to see how much he actively cycled versus passively cycled, you're not always going to have this screen right here, and I think it's on your page where it says like with motor and then you cycled. You guys see that? So that screen might disappear, and so you might have to go like a scavenger hunt looking for it, and in order to do that, you hit this little like magnifying glass at the top, or it might be like a little circle, and you can go through the screens looking for that. So once you get close to the end of your interval and you're trying to figure out what phase you need to move to next, you can just cycle through. Stop actively cycling for a second. So sometimes it actually gives you the option to, okay, so if he's passively cycling and you go through the screens, you can actually pin the screen on some bikes, but if you were to start actively cycling, you lose that ability. So it might depend on the bikes. I don't think all bikes you're able to actually keep that screen on the main screen part. Has anyone had any issues like with cycling any particular patients? I know you're the intervention people.
Just in general, or?
Yeah, just in general.
Had one head injured patient that was pretty agitated and couldn't get him to like actually go through the entire cycle. He would get through one evolution and then he would stop and he would sort of get, not clonic, but he would fight the bike. So we stopped and relaxed him, took him out, put him back in. And then your edema question or comment, we've had some experience there too with volume overload and external rotation. And as a therapist, it kind of worries me a little bit, but we got through the entire protocol
Yeah,
with one leg externally rotated.
I know with the acutely agitated patients, that's actually come up with a couple of our patients where they end up resisting the bike and they actually lock the bike out and cause like an error message to come up. Did that ever happen with you? And then you lose like all of your data?
Yeah, that's what I was
Yeah.
thinking over.
So if you're not at like if you're not at like the 25 minutes, that's kind of annoying because then you need to come back and you've lost all your data at that point, so you have like nothing to go off of. So we actually ended up talking to the vendors about that, if there was like any solution of like preventing that error message from coming up. And so I know in like the manual, it says for like default settings to have the spasm control off. But in a patient where they're potentially agitated, it's probably a good idea to put the spasm control on because it's going to prevent that error message from coming up. Okay, that's one of the tricks that we learned over here.